You'll know when you have a wild woman. She'll practice her craft without boundaries. She is truly autonomous. Her loyalty is only to the family she serves, a midwife who will not allow herself to be held back by a system she didn't create.
This podcast is for the birth keepers who want to grow and change. We are open to learning through self-reflection and supportive community. We are creating this space to explore without judgment. We are remembering we were
Born wild.
Hi, everybody. Welcome back to the Born Wild podcast. I'm your host, Lea.
And I'm Sophia.
Thanks for listening. We have an interview today I'm really excited about with Devon. I know you from transfers that I've had and clients who rave about you and just from around and community and Instagram. But I reached out to you because we wanted the perspective of someone who works in the hospital and someone who works with babies there. And just kind of hear about like what brought you to that? Like when did you start nursing and what drew you to working with pregnant, birthing people and babies and all that stuff? And I know that you also branch out into a lot of other really rad, groovy stuff. So I want to hear about that, and I want to hear what you're working on right now with coaching and stuff. So I'll just pass it over to you.
And a side note, both my babies are NICU babies, so I'm really appreciative of the NICU nurses.
Oh, thank you.
Yes, we're always grateful when, if we do need to transfer, just knowing that they're angels who take care of our families.
Thank you. It's nice to feel appreciated. So there was a lot in that question. So let's start. Let's see, where can I? I'll start with what inspired me to become a nurse. So becoming a nurse was a career change for me. I had done many things kind of leading up to that. I waited tables for a long time. I think working in a cafe was my first job. And then I thought I wanted to become a veterinarian at one point in my life. So I was a vet tech, and it was really fun. And then I started assisting in surgeries, and I decided, nope, not going to be the one to do surgery on animals. So I will not become a veterinarian. But I've always loved science and medicine and health. And I thought I wanted to become a hairdresser at one point too. So I decided I couldn't, I didn't want the responsibility of, designing people's hair and their look and all that. It was like too much pressure.
I'm laughing that so you went on to save babies' lives, but hair is just too much pressure.
I get it, girl.
That's hilarious. Yeah.
I understand.
I didn't think of it that way.
Nothing worse.
Oh my gosh. Yeah. So
stop at her hair.
Yeah.
That's just way too much responsibility for me, but yeah. But I was in beauty school. And so I thought, well, I love skin. So I decided to become an esthetician instead. And I still love skincare very much. And I keep my esthetician license current. So I worked in spas and I had my own business for a while. And then I had a head injury, and that's a whole other story and a whole other chapter in my life. But I continued to wait tables, and I had to let my business go because of my head injury, and was just couldn't kind of keep that going. So then I became a real estate agent because my mom's in real estate and did that for about a year. I sold a couple of houses, and then I realized that, I don't know, wearing pencil skirts and heels and, I don't know, marketing myself in that way. Not that you have to dress that way, but it just didn't feel like my heart was in it. So my roommate at the time was in med school, and she's like, I think you'd be good at nursing, and, you like science and health and all that. And I was like, I never thought of that. And so I started by taking an anatomy class at College of Marin, and they have a wonderful science department. So I just loved that. Like, I took anatomy and just fell in love with the human body, and just kept taking all the courses on my prereqs, and then got into nursing school. And I really wanted to become a nurse because I do love health and science, and I really wanted to help people with their health. But honestly, I never thought I'd work in a hospital. I don't know what I was thinking. I just thought I would do something that was health related, but not in a hospital. But of course, as I started doing my clinical rotations, that was kind of like the thing that you do, is like you pick what area you want to go into. And everybody was talking about getting into med surg because, you know, you get this kind of big picture of how to take care of all the different things that could go wrong with the person, I suppose. And you get a really good kind of intro to bedside nursing, but I knew that wasn't for me. And I really didn't know what I wanted to do until I had my maternity OB rotation at UCSF. And then I got, part of that was going in the NICU. And I just remember stepping foot in the NICU, falling in love with the nurse who was orienting me, and just seeing the little babies in the isolettes, and just kind of like having that like feeling, that intuitive gut, heart opening feeling of like, oh, this is what I could see myself doing. I could do this. And so near the end of my nursing program, we could pick what we wanted to have like as our area of specialty, and I chose NICU. And I got to do my preceptorship at Children's Hospital in Oakland. I really wanted it to be UCSF in San Francisco because I thought that was the place to do it, but they weren't taking students at the time. And so I got to get into Children's Hospital in Oakland because one of my professors worked there, and they accepted me. And so I got to do my rotation there for 3 months, and it was amazing. And then everything just lined up for me. They were hiring, and I got my license, and I applied, and I just slid right in and had a few years of experience there, and had my son a couple years later. I became a nurse in 2012. My son was born in 2014. And then it was brought to my attention that there was a job at Marin Health Medical Center, formerly Marin General, and their NICU. I have a friend that worked there, and it sounded really good to work close from home. And yeah, so I started there almost 7 years ago, and there I learned postpartum care as well, because when I worked at Children's in Oakland, we only had NICU babies that, you know, they get transferred from places like Marin Health. So it was like, now I've seen kind of both sides of the spectrum. Is like, oh, this is what happens, you know, before they get transferred to places like that. So, and we obviously keep some of our babies, you know, depending on the level of care. But yeah, I feel like as a bedside nurse, I'm really happy with the decision that I made to work in that environment. It's very rewarding. And as you both get to see how amazing it is every time a baby is being born. It's just like one of the coolest things.
Mm-hmm. Yeah. So what do you find you're doing most when you're there? Like, are you at like normal low risk deliveries, or are you mostly like with babies in the postpartum wing, or what?
Mm-hmm.
A little bit of both. I've had a few clients who are NICU nurses,
Mm-hmm.
and I hear like little snippets of kind of what they usually
do. Yeah, well, when I was at Children's Hospital in Oakland, so we had a lot of babies in the NICU there, and you'd have either one baby assigned to you or two at the most. So there, I only took care of babies in the NICU. At Marin Health, our NICU nurses wear many hats because we all cross-trained to postpartum. So I work in the NICU where I take care of the babies who are admitted to the NICU. I do postpartum care, mother baby care. We do like the well newborn baby discharge tasks, and we assist with circumcisions. And then in our hospital, we have a NICU nurse who attends every delivery. Some hospitals only have a NICU nurse come if it's high risk, but at Marin Health, a mother gets a baby nurse assigned to her baby for every birth. So the labor nurse can focus on the mom, and the NICU nurse can focus on the baby, and there's a 2-hour recovery period for the baby. So yeah, and I think there have been less NICU admissions since we've had NICU nurses there, because we can kind of catch things early on and intervene early on, and kind of prevents, you know, other things from happening down the road that might get missed. So yeah, it's cool. I use the word cool a lot, by the way.
Right.
Now my son says it too. He's always like, cool.
That's awesome.
Yeah, I love your posts on Instagram of his artwork.
Oh,
so great. He's so talented.
Oh, I want to see
cool. Yeah. He's 9, is that right? Or 10?
Oh my gosh, tomorrow's his birthday. He'll be 9 tomorrow. Yeah. Yeah.
Happy birthday to you.
Oh, thank you. Yeah, I've been reflecting a lot about my own kind of birth process and parenting and mothering and all that.
Mm-hmm.
You know, every year when it gets to be near his birthday, I kind of have flashbacks.
I know that we have a lot of parents that listen to this podcast too, not just birth workers. Some of the things we had talked about that we wanted to touch on is like one from a birth worker perspective of coming in and bringing families, but also on like a parent's perspective of like what to expect if they have a NICU stay, like just not I was gonna say pros and cons, not pros and cons, but just like, yeah, I guess what to expect. Because I'm sure somebody can imagine and it just is like scary, you know, but like as a parent who's listening to this, who potentially might end up in a NICU, what is the experience that they can expect?
Okay, so what can a parent expect if their child, newborn, would go to the NICU? So
like how involved in care of the baby, and I know it's so dependent on how sick the baby is, you know, but I'm sure that there's some families here like, oh, like, am I even going to be able to see my baby? Can I hold my baby? Can I, you know, they feel like maybe it's just like an all or nothing kind of experience. In the NICU, the baby is the NICU's.
Right. Yeah. So, I mean, we keep a lot of our babies, which is really great if they have to go to the NICU. So we do prioritize keeping mom and baby together as long as possible. Like even if the baby's having, you know, like a little bit of grunting, we'll kind of watch them for a while. But you know, obviously, if we have to intervene right away, then we intervene. And a lot of times they're able to stay. Well, they'll stay in the room for a period of time. Like even if we're having to help, you know, breathe for the baby a little bit or do some CPAP. But if the baby's not, you know, turning around as quickly as we'd like them to, and they need to have, you know, some care in the NICU because they need some respiratory support, then we just either carry them over or we'll wheel them over. There's a little warming table in every delivery room where we put the babies. And then, so we bring them over. And then as soon as mom is feeling good and up for it, she can come over, you know, and dad can come usually right away too with the baby. And they're welcome to come anytime. And moms, we ask them to, you know, one of the things that families can do for their baby when their baby's in NICU is help mom get some breast milk. We help hand expression, get them pumping. And that always feels really good because then we can give the breast milk to the baby and and they can come visit anytime. So, and you know, the length of stay is obviously dependent on what's happening with the baby, but if mom gets discharged sooner than the baby, then we will usually have a room for mom to stay in. We call that rooming in. And so the mom can stay in the hospital and then come visit the baby. And both the parents are allowed to be at the bedside 24 hours a day.
That's great. That's amazing. When I had the surrogate baby in April, the parents obviously were there for the birth. So was Sophia. And she was born 36 weeks and 6 days. So she was admitted very, very briefly to the NICU just because she was early. And it was so great because they had a whole room for her parents and her. And, you know, I waited a little while to go visit because I was recovering and had a little bit of a hemorrhage, etc. But when I did, it was so sweet because she was like in pajamas and she had lactation. So she was like latched with baby and it was a really interesting situation because it like I really just felt like a birth worker in that context. Like for me, like, watching her catch her baby and then like going to visit her, I just felt like I was visiting the client or something, you know, just like walking into the room. So I just think it's really great that at Marin Health, they do really try to accommodate. And that was a very unique situation, but just with NICU admissions in general that you do bring in, like that's because that was what you're.
I was going to say it's probably so dependent on the hospital and obviously the baby situation. So my son was at UCSF campus, and in the NICU, it's just like one really small room. And there's, I mean, you could be up there with him, but there was nowhere to sleep. There was like a little, you know, chair or something. So we had like a downstairs Ronald McDonald setup that we had for a short amount of time, but then we had to get a hotel room. And so we were like across the city, you know, and I'm like pumping and my mom's running milk over in the middle of the night every couple of hours,
Right.
you know, it's just like kind of a nightmare. So it just is so dependent on where you end up. And then with my daughter, when I got discharged and she didn't, we lived only 5 minutes away. So I could have just gone home, but I'm like, no, I'm not leaving. And so there was a building in the parking lot for like people who live far away, but there was nobody in there. So they let me stay there. So I could go there at night and sleep, and my husband would stay with her, and then we'd swap. And I'd be with her during the day. But it's so great to be able to keep the families together.
I agree. Yeah. And it's obviously so dependent on the hospital. I mean, occasionally if we have to transfer a baby to UCSF, that's always hard because it's so far for people that live, you know, in Marin County, and then they don't have the same accommodations. I remember when I worked in the NICU in Oakland Children's, it was a huge NICU. There really wasn't any privacy there, although we did have, you know, parents were at the bedside doing skin to skin and all the things. And our NICU in the old Marin General was more open and less private. And with the new one, it's really nice because all the bays are private. So each baby has their own little nook, and there's a nice, comfortable chair for the mom to kick back and do skin to skin and breastfeeding.
Yeah.
And yeah, we used to we're updating our policies and everything with the like the preterm babies, which you mentioned, Lea, because not all of them have apnea prematurity or necessarily need to be monitors, and need to be monitored. So that's always tricky because they're obviously going to do better with the mom, but we also have to, you know, look for anything that could go wrong because we want to send them home, you know, healthy and ready to be home on their own. So we always tend to, we try to follow what UCSF does, and they allow their, I think even like 35-ish plus weekers to stay in with the parents the whole time and just assign a NICU nurse to them. So they're getting more frequent vital signs. So we're leaning in that direction, but you know, it takes time to update the policies and practices. So, you know, it kind of depends on the pediatrician and the gestational age of the baby. But usually they just, like when they're that, like a late preterm and they just need a little bit of NICU observation, it's for a short period of time. And then we try to get them back out to the parents as soon as possible.
Yeah, I think she was there for like 4 hours or something because she was obviously fine.
Yeah, right. I mean, some it's a few hours, some it's a few days, some, you know, if they're born really early, it can be a few weeks. So, yeah.
Do you have any advice or like, you know, for parents who are having their baby potentially be in the NICU for a period of time, like just ways to take care of themselves or things to bring or things that are like you found it helpful or things you've seen that you feel like is more stressful for parents, or just any advice for families?
Yeah, and I think that depends on how many other children the families have. I think that's always hard, you know, when there's another little one at home. Sometimes, you know, the dad will have to leave and go take care of the little one if the parents don't have any family in town. You know, and if it's just the one baby, I mean, you know, it's different obviously for every situation, but it's always nice, I think, when the mother can be there as much as possible to do skin to skin and, you know, for bonding and milk production, to spend as much time as she can at the bedside, but also wanting to honor the amount of sleep that a new mother gets. So, you know, it's totally fine. Like if she needs to go back to her room and sleep. And then during the night, you know, as upsetting as it can be to have your baby in the NICU, I guess one of the blessings is that parents can get a little more sleep because the nurses are there taking care of the baby. So they can kind of, you know, catch up on some sleep that time to get rest and pump a little bit, you know, and then come back in the morning. And that's usually hard for parents because they want to be there, but then it's like, we really try to encourage the moms and their self-care and getting their rest in too, right? Because that'll help with the milk production and they'll feel more refreshed taking care of the baby during the day. Getting good food. So if there's any, you know, favorite foods, you can have takeout or bring food in. We do have a cafeteria there where families can go down and get food, but, you know, just thinking of like comfort foods and things that you like, bringing those with you or having someone drop them off for you would be helpful. Yeah, I'm trying to think what else. I mean, some families, I mean, the thing, unfortunately, like flowers and things like that, or aromatherapy, they can't have in the NICU, but those things can be in the labor room. So anything like, you know, electric candles or, yeah, some people bring diffusers in or flowers or anything that just kind of makes the room feel a little more lovely while they're there. I mean, the new hospital's got amazing views, so that's really nice. People get to look out and see Mount Tam and
Surprised that I couldn't have feathers because we tried to bring some things in to, you know, spruce up or whatever. And there was some sort of, I don't know, sign thing that had like a feather hanging, but like they couldn't have anything living, you know, or that like could actually have a bug on it or, you know, something.
yeah.
Like
Right.
that. Yeah. And so I was like,
flowers, but not
no,
feathers.
you can't have flowers.
Oh, right, flowers.
Yeah.
Yeah.
Oh, but because I remember being like, what? No feathers. It was like a feather dangling from a string or something like that. Yeah.
Well, some parents bring they bring like photos of them, you know, and that's really cute. We can put those on the crib or the isolette, or like, you know, some artwork. Sometimes a sibling will draw some artwork and the families will bring that in to put, you know, at the baby's bedside. So yeah, little decorative things are okay. We have the breastfeeding pillows, the breast friend pillows, in every room, and also for NICU use, so families don't need to bring their own. Yeah, my mind's a little blank right now, so ask me more questions.
I had a question. This is something that I've been curious about. And over the years doing births, I feel, I mean, there's a lot of things that have shifted where like, you know, birth plans used to have like these very, you know, there's a lot of like commonality or kind of uniform things that people put on birth plans that have kind of stuck around over the years that I almost feel like aren't, and it's obviously very dependent on the hospital and situation. But like one thing that people often put is like, they don't want formula given to their baby, or some people say sugar water, which I don't,
or pacifier,
or a pacifier. And my experience with Marin Health, I know a few of the lactation consultants because they used to be midwives. And it doesn't like, do you feel like that's something that people, I mean, people can put down whatever they want, obviously, but it doesn't seem like a very common practice at Marin Health. Like I don't, you know, and obviously like it's very dependent on the situation, but it seems like there's a lot of effort put into really trying to get baby breast milk, as opposed to, you know, like I think there's this fear that like the nurses are just going to like give their baby formula without asking, or, you know, whatever, or they're going to have to like really kind of fight that or advocate not to have formula. So like what, I'm curious what kind of the policy is, or it's just like, that's something I've felt like whenever people show me their birth plan, I'm like, I don't actually, I mean, say that it's good for everyone to know, but I don't think it's like a go-to thing that you guys do.
Yeah, I mean, there's a few things, the birth plan and then prioritizing the breast milk. It's always interesting when I read over people's birth plans these days. I'm like, oh, this is what we do anyway. Like baby goes skin to skin. We keep mom and baby together all the time. Like we might have to bring them away for an hour to get their discharge tasks done, but families stay together. We will delay, you know, weighing the baby, doing any kind of like interventions or medications until mom and baby have had a good breastfeeding session in and have had plenty of time to bond. And that's usually in delayed cord clamping. Like these are usually the things people put on their birth plan that we do anyway. And yes, we totally prioritize breast milk over formula in our hospital. We're baby friendly. Our lactation consultants, our pediatricians, our nurses are all on board with that. So we can go to the mom and teach her how to hand express or do it for her to get some colostrum. We'll get mom pumping within 6 hours if mom and baby are separated or if they have a late preterm, to ensure a good milk supply. And yeah, the only time we would have to give a baby formula is if, you know, there were any issues with milk production, or maybe if there wasn't enough colostrum or milk right away and the baby was having some blood sugar issues. We have the glucose gel now, which is pretty cool. It's like if babies have low blood sugar, we can massage that into their gums or into their cheeks instead of formula. I mean, sometimes we have to give a little formula too, but sometimes that's all they need is the glucose gel and then maybe a little bit of colostrum, and it stabilizes their blood sugar along with skin to skin. You know, the studies show that helps with their blood sugar too. So we love mother's milk, and we'll do our best to ensure that this is what we're giving to the babies. And then we'll always ask the parents and check in with them before we give them formula. Like we wouldn't just give a baby formula without talking to the parents about it first.
Yeah, I feel like it's kind of like a vestige of like old, I don't know, people who have a lot of anxiety about the hospital. I try to say like it's not like it was like in the 80s.
Yeah.
You know, there's a lot of policies
Yeah.
that happened, and like no one's gonna do that.
Yeah.
Give that to your baby without.
Well, and like as a NICU mama, I know that there's sometimes some confusion around medical terminology, and I was a student midwife at the time, and so I had a little like more knowledge, but I remember being sleep deprived and a little confused and having a lot of information thrown at me and having conversations about like that my son needed more calories. And so in my head, it wasn't clear. I was like, okay, he needs to eat more. But that to that meant fortifying my breast milk formula. And I didn't know that's what they were talking about. So sometimes there could be miscommunication too, where you're like not entirely clear on what you're agreeing to. Because I remember when they started fortifying, I was like, what are you doing to my breast milk? And they were like, you wouldn't do this. I was like, what are you talking about? And I was like, oh, when you said more calories, I just thought we're going to feed him more, you know, but
I see.
But there was just like a little confusion. But talking about birth plans it made me it reminded me about the BRAIN acronym. Because I know for our families who are like choosing home birth, they really want to be a part of their own care and like decision makers. And so that's probably one of the concerns with going to a hospital is like, do I just hand over my baby and have no say in anything? And so one of the things I'm always reminding them about is the BRAIN acronym, which stands for benefits, risks, alternatives, intuition, and then N is either like need more time or do nothing. And so that they can not end up in those situations where they're like, I don't know what I just agreed to, but that they can like be asking questions and like being a part of the decision making. And I'll leave that in the show notes too for anyone who needs it. But it was really helpful. I had kids that needed a lot of medical decision making and all the way from like heart surgery. And I'm like, screw the BRAIN acronym. I have no idea about any of this. My baby, you know, do what you went to school for. And then they're talking about supplementing with formula and being able to like pull the strings back in a little bit and being like, okay, I want a little more decision-making power here. That acronym was really helpful for me, knowing like that I'm an active participant in my baby's care. So I wasn't sure if you knew about that. It's a helpful little acronym.
No, this is the first time I heard about it, and I really like it. Yeah, it's good. I like the intuition part, and then needing more time.
Because sometimes I think it can feel like, oh my God, do I have to decide now? And it's like, no, if you just ask, like, is this urgent? Do I have to decide now? Can we have a half hour? Can we have 2 hours? And then they can like just sit with it and be like, okay, what do we want to do? But you know, so that way they know there's like no rush, no pressure, or there is like, we have to decide now kind of thing.
Yeah. And I feel like the pediatricians that we work with are all really excellent at communicating with our families and really calm, and they take their time explaining things. And so, yeah, there's lots of space and opportunity for families to you know, get educated, use their intuition. If they need more time to mull it over, of course, yeah. If it's not an emergency, of course. So yeah, as you're asked, as we're going over all this, it just makes me feel really good about the team that I work with because, yeah, I think we definitely prioritize, you know, the families. They're the ones, it's their baby. They're the ones making the decision for their child, and that's what. I mean, if it were me, I would want to be treated that way as well. And then when we were talking about formula and you were saying how different it was like in the 80s, well, I'm like a 70s child. And, you know, my mom had issues breastfeeding at the time, you know, because I was cranky. I wasn't getting enough. We weren't sleeping. And at the time the doctors were like, just give formula. And it's like, okay, you know, there was no like lactation intervention, you know, trying to help the moms with the milk production. So yeah, things have really, swung in the opposite direction. And it's cool to see the amount of support we give for breastfeeding and breast milk production. And on the other hand, I just don't, it always breaks my heart when a mother is trying so hard and, you know, and they just want to give formula, or, you know, they don't make enough milk. And so formula is the only option. And then there's this handout that they're given that says like all of the risks of formula. And I almost feel like that's like one of the worst things you could give a mother who's like postpartum and hormonal. And it's like, I don't know. I'm a little bit like, yes, you do want to know the education, but if your mind's already made up and that's your choice, like I was primarily formula fed. I think there's a lot of babies who are, and grownups who are now, who are doing fine. So I think like it helps to take some of the pressure off. Like for example, I had to supplement the entire time I had to pump. I didn't produce enough milk. So I had to, and it was exhausting. Like I'd breastfeed my son and then I had to pump to keep my production up, but I didn't always have enough volume. So it was and he got a lot of my breast milk and I did the best that I could for 8 months. But the amount of pressure I put on myself, like threw me into postpartum depression.
Yeah.
And, if I could go back in time, I would have lightened up the load on myself around the fact that my son had to have some formula.
I was like just about to bring that up. So what's always interesting is how the pendulum swings.
Mm-hmm.
And to me, it's like, and like when we have families who are having issues with supply, like our first kind of line is to reach out to our community and ask for, donor milk. And I like feel really great about the community we have because I almost always get plenty.
I was able to feed my son donor milk for 2 years.
I've noticed that that you've put those posts out there. I was like, this is so amazing because I had friends that had babies and like I think one offered but didn't get around to it, but I couldn't find any donor breast milk.
Well, and I think like with social media now, there's so much more like everybody's on it, and it's just like I find that it's a lot easier. But what I was gonna say is I've definitely had families where, like this is a mom who is completely exhausted and already judging the shit out of herself and doing everything she can to make enough milk, and and sometimes like formula can be a great tool, whether it's like I've had people do it for babies like just to kind of get over a hump, like while mom's building up her supply, or baby, for whatever reason, like they just need to kind of get over that like back to birth weight curve and then kind of take over, or where they just end up supplementing. And I've even had a couple moms where hormonally breastfeeding for them made them really depressed and was actually like really triggering for them or was really difficult. And I've had these conversations where I'm kind of like, again, it can go extreme in either way, where I'm like, it's okay to take care of your needs. And there's something so deeply difficult, I think, for women, for birthing people, when you can't feed your baby. Like there's something about that. It's like when you're pregnant and you want to take care of yourself, and if something happens, it's like so devastating.
It's the feeling like I can't even do that kind of feeling.
Right. And I think it's
exactly
primal and it's societal and it's all these different things, but like the anxiety and the heartache that comes from not being able to nourish your baby as much as they need is devastating. So formula, and there's so many different formulas now, like I always recommend, I think it's pronounced challah, that's like, it's from the Netherlands and it's like from goat milk and stuff, but I think that it is really important to also point that out, is that like it can be a good tool, and moms who end up using it are not terrible moms, and those babies are
exactly.
And obviously breast is ideal, and I know that you really focus on that, but not adding shame to the pile, especially to a mom who's probably already feeling a lot of anxiety and exhaustion, and maybe their birth didn't go the way that they had dreamt, and so they're already feeling like, oh, I wanted, like for example, I wanted this home birth and I had everything all planned out, and then I cesarean, and now I can't baby, and I'm so I think that thanks for bringing that up, because that's something that I run into, and just
it requires just so much surrendering into like wanting things to go one way and then it goes very, very differently, like, and some of the things that you just said, like I remember just going like, what, over and over again, why didn't my body make enough milk? Like, I'm healthy. How come my body isn't doing what it's supposed to do? Over and over again. And another challenging part is when a mother has to pump and then you're home with a newborn. It's like, here I am with the pumping machine on and my baby's sitting in a little seat next to me crying and wanting to be held. And I'm going, hold on, little buddy, like 10 more minutes. And I mean, that's nerve wracking, right? So yeah, it's really challenging to find a balance where, you know, you can feed your baby and then also not drive yourself into postpartum depression at the same time, like I did. So
and I just found it so interesting. Like, I've had a family recently who had just like super straightforward, smooth birth, and then supply issues, and just there wasn't any like thing to point to where it was like, oh, she's anemic and she had a hemorrhage, and then, you know. And then someone who went very past their due date, so I released from care, who I've connected with again, and who's just swimming. Just like, you know, and this is a mom who would be probably categorized as someone who would maybe have difficulty just like with hormones and with age, you know, just the whole thing. And it's just like Venus of lactation.
Love it.
So, so
I still like when I see moms with this overabundant milk supply, I'm just like, man.
Pull off. Nice. Like, I have them in the ergo carrier, like at Trader Joe's, and they would just like pull off because they'd get distracted, and it would spray across the aisle.
Wow,
it's just wild.
That's impressive.
When I'm lactating, I'm like a double D. Yeah, and I'm like a minus A normally, so it's just funny. But
well, I remember it's like that feeling of freedom, like if you don't have to pump or, you know, so for example, I had a taste of that before I knew I wasn't producing enough, and just feeling like, this is so cool. I remember being in the car with my husband, like, we can just like pull over and I can feed my baby and we're just doing our thing. Like, this is so cool. It's like, and then my whole world like crashed down when I had to start, you know, the pumping and all that. So there's a sense of freedom, you know, when you can feed your baby.
Do you feel like that experience, I feel like I probably know the answer, like helps you to empathize and be more connected to mamas who...
Oh, absolutely. I mean, like I totally had, we call it the nurse curse, you know, where like nurses have, you know, like for example, my birth had like every single intervention you could possibly, you know, I was like post dates, I had a prolonged induction, I had choreo, meconium, I was in labor for 36 hours, I pushed for 4, got to +2, had a vacuum and then C-section, and then, you know, postpartum depression and trouble with my supply. So yes, I have a lot of compassion. I've been there. I know what it's like. And raising a child, it truly takes a village. And it's, you know, not everybody has a partner or family nearby or, you know, a postpartum doula or someone that can kind of help them navigate all of the feelings and the things that come up. And I was very alone and isolated when I had my son, and my husband went back to work after 2 weeks, and we live out in West Marin, and people think it's such a far way to go. And, you know, it's challenging to be alone in that environment, even though with your baby and you have so much love for your baby, but there's this sense of loneliness at the same time. And, you know, I wish that I would have hired like a postpartum doula or just had more, a person, you know, that I could talk to more regularly, or, you know, just come and like be there for me and listen to me and like kind of go through that process.
And they're not sure what they want to do for a living, become a postpartum doula, because somebody decides at the last minute they want a postpartum doula, it's too late. They're booked out like 9 months in advance. We do not have enough postpartum doulas right now because people are catching on how helpful it is. And they're just booked out.
Yeah. And I mean, that's something I've considered being available for. Like I could potentially, you know, visit someone at their home, but I'm definitely available like for a phone call or a, you know, a Zoom, or just to be there and help mothers kind of navigate that time. But yeah, because don't you agree, like so many people, and it's amazing, like focus on the birth. And then it's like, oh yeah, now I have a baby. What am I going to do?
Popular for like 2 weeks postpartum, and they want to come see the baby and hear the story, and then they're gone.
Yeah. Right. Because so how you do postpartum visits, how long do you see? How long is your follow-up process for?
Yeah. So we, we do at least 6 in the first 6 weeks. So we're, there in the immediate postpartum after the birth. Obviously, we do the newborn exam and everybody's stable. And then we come back at the 1-day visit. And we do the newborn screen and all the stuff. And then 3 days after the birth, 7 days, 2 weeks, 4 weeks, and 6 weeks. But people, if somebody is having issues with lactation, we will come more frequently. Or we have like a lactation bag. Sophia started this, that has a scale and an S&S tube and like different,
nipple shields and cups and stuff like that. Because usually when you need it, you don't have time to order all that stuff. You just need it.
Right. Yeah.
We'll just like,
that's great.
So they'll keep an eye on weight, and however they need to get milk into the baby, they can get it in. And
so they'll like do a check-in with us every morning or evening, or like, just a consistent time for weight for baby so that we can track it.
Make adjustments like, oh, this is working, keep going, or like, this isn't working, what's the plan?
Yeah, 6 weeks is that's a decent amount of time. I think like birth doulas maybe offer a couple postpartum visits, and
well, it's in
then at that point you actually need a postpartum doula to go farther.
Yeah, it's in our scope to take care of mom and baby normal, healthy, for the first 6 weeks, and then usually after that people do the 2-month well baby checkup.
But we have people calling us for years after, like my baby has a fever, and just mom to mom kind of thing.
That's sweet. That's always the concern, is the fever, right? Oh, I just remembered one more thing. If anyone for bringing something for a NICU baby, we don't have them, and I wish that we did. We might have had a few and now they're gone, but is like one of those white noise makers that sounds like the womb, like an ocean sound. I think like babies respond really well to that. Like when a family or a caregiver's there, we can shush into their ear and they really like that sound because it reminds them of the being in the womb. And I always love it when a baby has a little white noise. I think it's really comforting for them.
It kind of drowns out the other beeping noises.
Yeah.
When we first went home, I was like, oh my God, it's too quiet. I can't in the room. So we still sleep with a white noise. We had the kids spend the night at my parents' house, and we had to go in the room and turn it on because we were like, I need it.
Oh my gosh. My son, like I said, he's almost 9. He still sleeps with the same, it's like Peruvian pan flute music that he's been listening to. I'm not kidding, the same
I love it.
album every night.
I can't wait for his like girlfriend or boyfriend or whoever to come over and stay over, and he's like, hold on, I need to put on my Peruvian.
Yeah, exactly.
That'll be
my gosh. Another funny thing I just remembered is I was at work the other day, and like we had this fussy baby, and my friend, one of my nurse friends, oh my gosh, I love her, she comes in, she just flips on the suction, we have like suction at all of ours, and it made like she goes, I feel like they just need that sound sometimes. Like, so it made like a white noise sound with the suction. I was like, oh, I never thought of that before. That's a good little tool there.
Great.
Well, I know we're I want to respect your time, but so I know just from conversations we've had, and also mostly just kind of stalking you on Instagram, it's just sort of like the branching out you seem like you've been doing recently with like coaching or circles or just stuff like we talk about self-care and about community within like the midwifery and just how to like support each other and not burn out like crazy, and just just like kind of things that we do outside of our like kind of usual work stuff. And you're starting something now. Is it specifically for nurses, or it's like about exploring? Tell us about it.
Oh, okay. So the integrative nurse coach program that I'm in. Yeah,
plug it in.
People always ask, is it like, are you a coach for nurses? And actually that is a thing. There are companies that will hire nurse coaches to coach healthcare workers. And like, for example, like nurses who are in high risk situations all the time, so that they have time to debrief, because when you're exposed to traumatic situations and, you take that on, that can start to affect the nurse's health. And so it gives nurses a chance to talk about what's going on and learn, you know, mindfulness techniques and things like that that can help their bodies and nervous systems recuperate from their line of work. So that is a thing. But it's a board certified 7-month program for nurses who want to be health coaches. So it's like a combination of a life coach and a health coach for registered nurses. And it really, like, basically when I quit drinking alcohol almost 7 months ago, like, I had been for a long time thinking about, like, I know there's something else I can do outside of the hospital where I can help people with their health and be of service, and I don't know what it is. And then it was like 2 weeks into my sobriety, this little voice was like, health coach. And I was like, oh my gosh, I could totally do that. It's like one of the reasons I became a nurse and went to nursing school is because I love health and I want to help people. So I was like, this sounds like something that I'd really love. So I looked into the program. It's with the INCA is the acronym. It's the Integrative Nurse Coach Academy. So yeah, I'm in cohort 41. So they've been around for, I think, at least a decade or more. And it's kind of it feels like a new-ish thing because a lot of people don't know about it. But yeah, I just had been thinking in my mind, like, what else could I do alongside my bedside nursing practice that would feel, you know, that would just bring in my life experience of everything that I've been through, my bedside experience, and my love for health and wellness kind of all together. And so I thought about, well, focusing on mothers and women would be a good place to start. So yeah, it's like I can meet with people in person or virtually and just kind of talk about, you know, what's going on. What does this person need help with? And it's different from working bedside because as a bedside nurse, you know, we go in and we assess and we pretty much tell the patient what they need and what to do. Whereas the nurse coaching is really asking the patient or the client questions and helping them figure out what they need, what their inner strength is, because I think every person knows what's best for them. So it's just a matter of helping them, you know, figure that out by asking them the right questions and listening. And then I can help, you know, with meditation. I mean, there's so many things like mother baby education or, you know, postpartum, all the fun things like baby wearing and swaddling and postpartum girdles, which I think we don't talk enough about, that I think can really help moms recover. Like, I know it helped me a lot after I had a C-section to kind of navigate my torso and be able to sit up and, you know, breastfeed my son. And yeah, and just to kind of like bring awareness around having a community, like we were talking about earlier, that it really takes a village. And I think that in our kind of patriarchal go society, it's like, have your baby and get back to work. And, you know, like, and that might really work for some mothers. Like they might have the desire to like get back to work right away. But I think, you know, a lot just really need that time and space to like go through the rite of passage of motherhood and to have support and community. And, you know, like if there's mothers out there that have friends that are pregnant at the same time, I think that is so awesome because, yeah, like I said, it can feel really lonely. So just having someone to kind of talk about, you know, like when you start going to like mothers groups, like I didn't find one until my son was 6 months old, you know, and so that was, or maybe 8 months old, but that's kind of when my world started to open up a little bit more. It was like finding another mom with a baby around the same age as mine and just having someone to talk to about all the things that come up with.
Can I bring you back to the postpartum girdle? Because we actually haven't talked about that on the podcast. Is it like good for every postpartum person? Is it specific to like if you've had a C-section? And like, I guess the follow-up question would be like, how do you know what size to get and how to put it on?
Is there a good like website information, or could you tell us?
Yeah, I mean, I don't know if everybody needs one, but I think, you know, I'm thinking about like in other countries and cultures where they do the belly wrapping after a woman gets birth because everything's kind of open and sometimes it's difficult to engage the abdominal muscles, especially after a C-section. Like I remember trying to sit up and I was just like, whoa, I don't even know where my abs or my torso is right now. So like there are wraps that you can do, but there are a lot of them are Velcro, so you can actually adjust them. You know, you they can go from big to small as your body changes, but it basically supports your back and abdominal muscles so that you can sit up and move around until you're able to really engage and everything kind of comes back together on its own. Yeah, and I think, yes. What's up?
Put it on lying down?
You can do it standing up. I mean, I've helped, I think from what I remember, I would do it standing up, and I help moms in the hospital do it. So we have some that are hospital size that we can have the doctor order and then show the moms how to put it on. But like, I mean, there's so many online. If you just search for, postpartum girdle and just pick one out that looks good, that has an adjustable kind of Velcro aspect to it. And then, yeah, it's just one piece. You just wrap it around and do the closure in the front.
And does it matter how high or how low? And does it affect like pelvic floor at all if you do it too high?
If you do it too high, yeah. I mean, I think it's just kind of more intuitive, it's just like what feels good. I can sort of look at someone and see, but you want it to wrap around. It feels snug. It feels supportive when you have it on. It shouldn't feel uncomfortable. It should feel supportive. I don't know how much the width of it matters. It should be enough to kind of cover a good amount of the torso without obviously, coming up too high on the breasts or too low to where it's hitting your legs.
Yeah. And if someone is interested in the coaching, how do they go about that? Can they hire you directly, or is it through the company?
Mm-hmm. It's through me directly. I'm really focusing on my Instagram account now, where I'm going to be putting out a lot more education around mother baby care and women's wellness. So my Instagram handle is @themotherbabynurse. But you could also find me under Devon Donkin. And someone could, if anyone's interested in working together, they can just send me a direct message and we can schedule a phone call and talk about what that would look like.
Show notes so people can find you.
Oh, thanks.
All right. I remember having a talking attack. Oh no, I don't.
Well, thank you so much for coming on.
Thank you.
Yeah, I always, I had my first daughter when it was Marin General, and then having what I call the hitchhiker last April there. I always really try to tell people if we do transfer, and we're going there, that it's really the best place. And it's funny, the family that we're talking about earlier, who's overflowing with milk, they had a great time. They were talking about their view and playing guitar or whatever, and they were like, it was just amazing. It was, so yeah, it's just really great always to get the perspective of people who are in the hospital, and it's just it's a great resource. I'm really glad that we have that in the community, and I don't know.
Thank you for coming on.
Thanks for being on.
Thank you. This is a lot of fun, and I think it's important to have these conversations between what you're doing in your world of the home birth, and then what can happen in a hospital. And that I think where I work, I can't speak to all hospitals, but I feel like it's a lot more like a birth center. We it's really about supporting mothers and how they want their birth journey to go. And I feel like, I don't know, people get all freaked out about hospitals and that we're going to make them do things they don't want to do. But where I work, I think we really allow the families to navigate, the experience that they want to go through. And it doesn't always go the way we want to go, but we're here to support that. And we do have the beautiful views, which makes it
it is
makes it really nice.
Thanks again for coming on.
All right.
Yeah, thanks for having me. Bye.
Thanks everybody for listening. You can find us at Born Wild Podcast on Instagram. For inquiries or feedback, you can email us at bornwildpodcast@gmail.com. You can find me, Emma Ray, on Instagram at Emma Ray, REA.
Sophia at sophiabirth.com, and me, Lea, at Bay Area Home Birth.
We would really appreciate it if you would rate and review us on Apple Podcasts. It helps us reach more people. And as always,
Stay wild.